I am tech analyst from CITIC. Two questions to Mr. Fan Weihao. First, why PingAn Good Doctor conducted a strategic upgrade at this point of time, and also what are the main drivers from industry perspective? A second question is, on the strategic upgrade, you mentioned PingAn Good Doctor want to expand offline network expansion. So, what resources or what support you want to involve offline support? Thanks for your question. Since establishment to IPO, PingAn Good Doctor has experienced fast growth. And actually, the fast growth also showcased the industry fast development. Under COVID-19, well, the outbreak of COVID-19 has changed the society, the lifestyle, and the economy significantly. We can see that against the backdrop of COVID-19, the business model of the internet healthcare has upgraded, and people's acceptance and awareness towards internet healthcare has increased and improved significantly. There are many stakeholders in the medical system, including doctors, nurses, and other practitioners, and they have come to realize that internet healthcare represents the future. And also, internet healthcare regulators, governments has attached huge importance to the development of internet healthcare. So I think the market environment and also government policy are the driver behind the development of the sector. And we want to leverage the opportunity. We want to make an strategic upgrade based on the private doctor services, and to support the tier diagnosis and consultation services to extend our coverage, the services and our offerings, and to improve the quality of our doctors. Of course, we know not all of the issues and problems can be solved online, but we want to extend online services to more people. And for small complaints and mild illnesses, they can be addressed online. I think this is part of the efforts to build a more professional and high-quality medical system. And I think the offline network plays a part in this process. Online and offline combination is part of our strategic upgrade. The ultimate goal is to address the pain points facing patients, and also to help doctors to solve the pain points, the difficulties in their work. For example, we provide different types of tools for doctors to increase accuracy of prescription. So this is the driver behind the strategic upgrade of PingAn Good Doctor. Actually, I have already answered this in my presentation, and we will lay out more specific measures. And Jessica said, I would like to add on to Weihao's point. Actually, internet health care will be the trend, and we already started to prepare that business 7 to 8 years ago. But why we make such a upgrade this year? Actually, the outbreak of COVID-19 accelerated the development of internet healthcare by at least 3 to 5 years. Actually, the market share of internet healthcare is only 3 to 5%, and in that market, PingAn Good Doctor is absolutely the largest. But I mentioned the mix of internet healthcare only accounts for 3 to 4%, which is small, but it indicates huge potential. The development, the pace of development, if you look at the developed world, actually the outbreak of COVID-19 accelerated that development. That's why we increased investment in internet healthcare and PingAn Good Doctor. But it will not happen by nature. We need to make an increased investment, and we need to address the pain points facing regulator and also national provider, national payer. And we also need to strengthen the customer behavior. We want to build a trust with customers and to increase the professionalism of our doctors and our network. At the beginning, PingAn Good Doctor mainly focused on its in-house medical team, but in the strategic upgrade, we launched PingAn Doctor Home. It's a sub-brand, and we strengthen collaboration with external doctors to push forward internet healthcare. So that's why we increased investment and made strategic upgrade at this point of time. Thanks for the answer. Next question goes to media friends from on-site. Thanks, management. I am journalist from Xinhua Finance. A question that PingAn Health ecosystem have incorporated many entities, but what's the respective role of different business, and what's the advantage that PingAn has in building a healthcare ecosystem? Well, the healthcare ecosystem is wide-ranging, and you cannot achieve it by focusing on the one area. If you only make investment in single aspect or single sector, it will not gonna to reap huge benefits or return. China's medical system faces some structural issues and pain points, and we need to address that pain points systematically. That's why we are different from peers, either it's traditional insurance company or insurance company. PingAn is serious in doing healthcare ecosystem and develop its healthcare ecosystem. We have been doing it in the past over 20 years. The multiple entities under health ecosystem focus on the patient side to influence user behavior and also encompass provider side, which encompass online and offline providers. PingAn Good Doctor is the largest internet healthcare entry portal, and we also partner with offline hospitals and providers to leverage resources and to empower them. On the payer side, we provide services to local SHI and other payers. We also cover government services, and we have advanced technology. Actually, we provide services to governments, and that's an important part of our medical ecosystem. Technology is our unique differentiation advantages. That's why we do not focus only one area, one segment. We focus on the whole ecosystem, the whole medical system. PingAn is the only company in China that have such widespread focus, but it's unique and it cannot be replicated by other peers. Thanks. Next question goes to online audience. I will first read out the question.
The question is, both PingAn Good Doctor and PingAn Smart City would like to solve 2B and 2G problems. What is the main differences? In what aspect they will cooperate, and in what aspect they will be in cooperation? 这个问题，他是讲，就是平安好医生和平安智慧城呢，他们都是要解决这个 2B 和 2G 的这个。
So to recap, PingAn Good Doctor and Smart City is to address issue with 2B and 2G. So what are the differences, the differentiation in their services? Which is, in what way can two entities work together, and in what areas they are somewhat competitive with each other? I think they are both represented on the stage. Maybe I will chip in to talk about their positioning. I think this is our clear strategic consideration. Allow me to respond in English.
Doctor, right? The collaboration is going to be more focused on very selective, picking the top institutions as well as top physicians to collaborate. It's an extension of the service that they will provide online with the rest of the network. So they can be very selective about who they work with. On the smart healthcare side, it is different, right? It is about actually covering as broad a network as possible, because that still constitutes the bulk of the service. But we're going to be more light. It's much more about technology enablement and influencing the service flows, right? So this is how they differentiate it. To give a specific example, we talked a lot about the internet hospitals. That kind of really started a few years back, but really blossomed this year. Internally, we have 3 different internet hospital collaboration models. We have a self-built, a collaborate with large hospital, and then what we call a hub and spoke regulatory and service platform, right? The first 2 models are covered by the doctor, right? Self-built is essentially we ourselves apply for an internet hospital license in any particular city. We ourselves apply for the social health insurance online reimbursement, and we will provide service just like any of the other offline online hospital, right? As one of the players in the market. That's done by Good Doctor. The second one on co-development, Good Doctor also work with basically top hospitals. These tend to be larger institutions who they themselves are now a bit overcrowded, and therefore they work with us to provide the online health diagnostics part of Good Doctor. And then it's a business collaboration, right? It's a business/technical collaboration whereby Good Doctor will provide the online part along with their offline network, and then they will have different splits of revenues about what is being done online, offline, and we complement the bigger hospitals in that sense. The third model, which is done by Smart Healthcare, is then from a regulatory and broader network standpoint. In many of the provinces, one of the reasons why they haven't really opened up a lot of the internet hospital online, there are very strict restrictions about what can be done online, what can be reimbursed online, is because from the Ministry of Health and the Social Health Insurance standpoint, you need to be able to regulate this properly, right? Because health is not like buying a bottle of water. You need to have strict rules about how it should be done. So we take the opportunity, we have a hub and spoke platform whereby Smart Healthcare work with the government as well as the provider, to provide regulatory provision service, but also what we call 拎包入住, I need to translate that, packaged kind of like modules that, the broader hospital, no matter how big or small you are, you can actually reuse some of the modules to provide that as an extension of your service without having to rebuild everything yourself. All these are done on the software as a service cloud model, so it's easily deployable. So you can see as an example of how these three models are very different. They serve different segments. It has very different purpose, and that Good Doctor and Smart Healthcare plays a very different role. Right, one is much more focused on business collaboration, and the other one is much more on technology enablement across the broader market.
好，谢谢 Jessica 总。
Thank you, Jessica. Now, coming back to the conference room, we'll take one question from the media. The gentleman out there. Thank you. In the morning, thank you for such a well-illustrated strategy and technology application in your ecosystem of healthcare. I'm from China Security Daily. I'm more interested in profits. So my question is about, in healthcare, PingAn continue to invest in this area. So my question is, in the future, how much more are you going to invest in healthcare, and when can you expect to generate profits? And if I may, in your ecosystem, the healthcare ecosystem, how much contribution and how do you, what are the contribution from the healthcare ecosystem into the financial business of PingAn? Let me take your first part of the question regarding the value. Where's the value? I think I spent quite a bit of time talking about three parts of values. First of all, value is manifested in being a great tool of customer acquisition. This is not out of the blue. Over the last 4 years, you see, even though this is being disclosed for the first time, but this is the result of the last 4 years of efforts. Like 15%, 20% of the new acquired customer actually come from our healthcare ecosystem. It's a great tool of customer acquisition. We say PingAn will do things, we may not necessarily talk about it, but we will do it. So we provide, services, and then we follow by products. This is important because it's got scenarios, it's got services. Secondly, it's a sustainable something that we can continue to drive the stickiness and loyalty of customers. We're not like other insurance company or financial institutions. We're not simply there to work with other vendors, service provider. The reason we build our own services, develop so much our own entities, spend so much resources, we think this is not about getting customers. It's only about traffic acquisition. That's easy. I just put my brand across all different portals, but it's not. So we are disclosing another number. 60% of the financial customers, 126 million of them, when they hold healthcare services from us, their revenue, AUM, stickiness, they grow more than 100% more than other financial customers who do not have our healthcare products. So this is a sustainable model, sustainable stickiness with healthcare plus finance. So these two in our core business, well, for those of you who are online, offline, you are analysts, you are better at mathematics, you can do the math. So how much contribution it generates to the insurance business? For these two reasons alone, we'll continue to invest. And the result is obvious, and there's going to be more headroom for further growth. The third synergy is actually coming from the healthcare ecosystem, the 6 trillion moving to 16 trillion addressable market I'm talking about. Now, if you look at the past, a lot of reports and coverage, there's a lot of investors out there, they will know in the last 3 decades, the only long-standing industry that survived the 2 financial crises and also the pandemic, the only ecosystem was the healthcare ecosystem. For the last 10 years, they were second place, but TRS was number 2. They are only after technology in TRS. So if you look at the last 30 years, the global financial institutions or the sectoral investment, healthcare was number 1, except for this year, which was number 2. So definitely this is going to be a long-term prospect. The reason we go for healthcare ecosystem is so complicated with 12 entities. Why we do it this way? It means a lot of work for me. I have to coordinate 12 different entities. But I'm saying, if you want to make money out of it, you have to deal with the pain points in the ecosystem by way of billing by services, by product plus services, by service license or operation charges. You have to address the pain point before you can collect money from them. So you have to really address the pain point to get to the 16 trillion market. So the first two reasons can be quantified. You can see the reason why PingAn Insurance, we're talking about the average value stickiness being so excellent over the years. But the third reason will gradually manifest itself in the subsequent future entities where they are going to be more transparent. They are either going to go public or they're going to be make more transparent so that you can see the value. For us, the third reason is a midterm target. We're going to see the value being released gradually. Now, to answer your second question, you just asked about the reason why we invest in healthcare, even though you don't believe that we can touch the 16 trillion. But actually, the first two reasons are sufficient to justify the investment. When it comes to the making profits, we disclose numbers, which is we invest around 100 billion in the last 10 years. In technology, R&D, we invest around 100 billion. We disclose that quite a lot, quite often. Among 100 billion, I would say 10–20%, they are healthcare-related investment in the investment in the healthcare ecosystem. So when are we going to make profits? In our core business, where they are driven, when they bring profitability, you can actually see how much contribution healthcare is making a contribution to our core business. And that's what we're saying. These companies do not have profit as the primary target. PingAn Good Doctor, I would say, in our internet companies, in the 4-stage development, from scenario to traffic, revenue, and profits. Profit is the last step. After you capture the market, just like auto home. If you look at auto home, the entire sector was in decline, but auto home maintained profitability. That is because we are in the leading position. They are in the 4th quadrant. Right now, Good Doctor is the 3rd quadrant. So we're looking at the market size, revenue, the position in the market. As I mentioned, we invest even more. We are in no hurry for Good Doctor to be profitable because we are aiming at a long-term profit. And smart healthcare is probably in 2nd quadrant right now. You are looking at the reason why we talk about, we didn't talk so much when we are making efforts, but you can see Mr. Cao and Mr. Xie, they have talked about that we are already built robust propositions. They are in this stage of bringing traffic and building revenues. So hence my response to your question. Thank you, Jessica. Now, we have a lot of questions coming in. I have received quite a few of online questions. Let me just read out the question in English.
Is from online, Tri from Citibank. The question is, regarding your healthcare ecosystem and synergy, how would PingAn Group allocate resources to internet healthcare platform? And which resources will be the primary? 他的问题是，就是关于
So the question is about the healthcare ecosystem and synergies. How will PingAn Group allocate resources to internet healthcare platforms? What are the prioritized resources to be allocated?
There are 2 ways to look at it. There's the actual financial investments that we made, as well as the channel and customer resources that we allocate. In the first one, just on the previous question, I mentioned that in the past, our historical past 10 years, we shared that we've spent about 100 billion yuan on new innovative investments, of which roughly about 20% is health-related. Going forward, we've also publicly disclosed before that in the next 5 years, we'll spend another 100 billion yuan or so, of which 20–30% is going to be in the healthcare investments. Right? So this is one of the most important ecosystem amongst our 5. That's financial investments. In terms of resources, this is an ecosystem, as you can see, that is synergistic with our customer as well as channel resources. So as Wei Hao mentioned, we actually make available our entire 210 million financial services customers. We want it more, want more and more of our customers to have healthcare-related services. We're opening up. We have opened up and continue to leverage our channel access. Channel access being what Wei Hao mentioned in our government access through smart healthcare, through our corporate customers. We have 4 million corporate customers, which is going to be a key component of providing more healthcare services and expenditure for their employees through our own agents, right? Which is a very synergistic bundle between insurance product and health services. So I think the intangible resources is actually even much more significant than the scale of financial resources we'll invest in a health ecosystem.
谢谢 Jessica。这是第6个问题了。
Thank you, Jessica. Next, the sixth question is from media friends from on-site. The gentleman at the back. Thank you, management. I'm from VCBit.com. VCBit is a media focusing on internet and healthcare. My question is quite specific for PingAn Good Doctor. Why PingAn Good Doctor launched PingAn Doctor Home, which is a new brand of PingAn Good Doctor? And is there a new measure that you want to communicate with us? And what influence will it have on PingAn Good Doctor's business? Thanks for your question. I have actually briefly introduced our PingAn Doctor Home. PingAn Good Doctor. Well, in August 2019, PingAn Good Doctor launched private doctor product. This product, well, in the almost 1 year's time since its launch, it has been well received by the market. And well, it's also supported by our insurance channel. The sales volume exceeded 420 million RMB. This is the data for the first half. It's indicating a growth of over 200% year on year. It's the revenue from membership products, and also the satisfaction rate of our private doctor has reached over 95%, so it's well received by the market and has been very popular. But I have also mentioned currently the market environment is very favorable, including government support, etc. That's why we decided to increase investment. The investment was mainly in that we upgraded the product of private doctor. So Doctor Home is an upgraded product based on private doctor. We provide very clear positioning for the different products. Private doctor provide customized solutions for different types of patients, and also we provide very concrete, customized solutions and proposals for our patients, and to build trust with our patients and users. That is the positioning for the product of private doctor. And also through this product, we hope to get access to household and families to give them household-based medical services and health management products. That is our overall positioning for private doctor and also the positioning of Doctor Home. Another connotation for Doctor Home in Chinese, PingAn Doctor Home means a home for all the doctors. It's a family for the doctors. So it's not simply what our business have covered. It's a super big virtual office for doctors, and to build a doctor ecosystem to empower doctors to provide services more efficiently, more professionally, in a higher quality, and to get more support, and also to build a deeper, closer relationship with their patients. The ultimate goal is to empower the doctors to provide support to them. So we give them a better career, and also to help them to provide services to patients more efficiently and with higher quality. So this is the empowerment to doctors in two aspects. The doctors can also have communication with other peers. They can communicate with their peers, famous doctor, renowned doctor from other hospitals, other cities. So this enables them to strengthen peer communication and to improve themselves, and also to have a better medical career, and also to provide better service to patients. So the launch of the new brand, PingAn Doctor Home, ultimately aims to provide trustworthy, professional, and convenient, easy-to-access services. Thanks for the detailed explanation and answer of Wang Zong. Well, the many questions are coming in from online, but according to a rule, let's give the next question to analysts from offline. Thanks. I'm a TMT analyst from UBS. I have two questions for the management. The first question is about, well, actually we have, first is what are the synergy? We have heard a lot of the synergy between entities, but could you please give more color on the specific flow of the synergy? Is there any specific example? And second question is that internet health care has witnessed the release of many supportive policy, but SHI payment is handled on provincial government level. So I would like to know for PingAn's health ecosystem, which encompass many separate entities. What support can the entities and the health ecosystem get from the support? Just to clarify for the second question.
So, how can our ecosystem of the PingAn healthcare to tackle this kind of like a very fragmented system?
是医保的还是卫健的？你是讲？
医保。
医保的 ，OK， 好。这个我举个例子吧，哈，这个从逻辑上我刚才有解释横跨和直跨的。
I will give one example, so that you have the idea. Just an example of chronic illness management. I have mentioned there are 200 million people live with chronic illness in China. So when we age, well, around at the last 10% of our life, many of them live with chronic illness. So chronic illness expenditure accounts for over 60% of China's medical expenditure. So how to address this pain point? We know that chronic illness is not covered by many insurance. So how can we handle the big expenditure from chronic illness management? An example is that we have 3 entities that collaborate to provide services on this front. This is just a forecast. Very soon you will see more specific things and products and services come up on the market. We use a Good Doctor, Smart Healthcare, and another entity to provide chronic illness management. If it's only covered by insurance company, well, you can see there are many medical reimbursement insurance products on the market, but they don't cover chronic illness. Why? Because the expense of chronic illness management is out of control, and it's hard to measure whether it's fully cured, whether it's fully covered. The expense or the gap between them is huge. So the cost from chronic illness management cannot be fully covered by insurance. So we need to get other providers involved. We need to rely on SHI payment, which is social health insurance, which is provided by medical insurance provided by government. So, but PingAn Good Doctor provide some portion of the services. For example, we have online doctors and nurses that can provide services, which is only part of it, not all of the services. That's why we need a third part, which is smart healthcare. Well, Jeff and Guotong already mentioned this. They provide, they involve government doctors in the system to provide one-stop services, ranging from smart disease forecast, smart diagnosis and treatment, and also follow-up management, etc. There are many different activities, over 175 parts of the activities for the whole process. And this is bundled or work in collaboration with insurance. This is the 3 parts in dealing with chronic illness management. You see, the synergy is in 3 fronts. First is synergy in product pricing, because we have the data, we have the control, we have the management, and we can price products well. The second is synergy in channel. This is only a very simple example of the synergy within our health ecosystem. But, well, it's because it's hard to replicate that it will become our mode, competitive mode. Your second question is about the fragmented health care and SHI policy across different cities in China and how we deal with it. Well, we started PingAn Health Connect business in 2012, and yeah, indeed, the SHI payment policy is very complicated and different across different cities, and we have established a database encompassing all of the different policies of different local governments. We have the huge database and also different computing parameters to help government to control costs and to formulate annual budget. These services can only be provided by PingAn because we have such a huge, massive database. And this is also in line with the DIGS policy that is being promoted by national government. It's very similar to super-fast auto claim settlement. We have the data and we know how to address the situation, different cases differently, in a different way, and to provide customized solution. It's very similar to our smart auto claim settlement. We have built, for claim settlement, we have built database for different parts. That's why we know how to accurately address and handle auto claims.
我们是回到媒体
Now, last question will come from the media. We'll reserve the last question the friends from the media. Thank you, management. I'm a journalist from China Economic Weekly. I have two questions. In the future, the healthcare ecosystem, how do they enable your life insurance, your insurance business? And the second is, what's the PingAn's view on the changes and opportunities from this COVID pandemic in the future? What else are you going to focus on in the future? I actually answer your first question. For our main business, is about customer acquisition, improving stickiness, improving more share of wallet from customers. But for the empowerment or enabling from ecosystem, I will leave it to Jeff and Guotong. You talk about after COVID, how do we work with cities? Am I hearing you right? So what's your view on the opportunity presented by the COVID pandemic? And what else are you going to, deploy into this healthcare industry? Well, maybe Mr. Fang can chip in later. So we work with many governments, like Health Commission. After the COVID, we have seen three type of changes. Firstly, we talk a lot about they are being more open and receptive and encouraging to internet healthcare, because as last year, many healthcare commission they are a big concern of the risk with internet healthcare. But with the COVID, people are not going to hospital. They don't want them to leave their home, so they have to go to online, particularly for chronic diseases. They have seen that indeed after making it available, the experience are great and the risks are also being well managed. So they're being more open, and also they are trying to make up for the disadvantages or some of the weak links in the system, because we have 45 billion of the funding from central government to address some of the weak links. Well, in this COVID pandemic, our actually medical healthcare system, they haven't really played a role very effectively. So some of the community level primary care, they haven't done enough to prevent and control the pandemic. Therefore, like the primary care, community care, they have to set up a fever clinic. They need to have a diagnostic capability. They need to have some of the capabilities, the venue and ITs at the primary care level. So the government is interested in boosting primary care, and also thirdly, digitalization and IT to fight the pandemic. We've been dealing with several provinces and cities about extending the data further to school data, pharmacy data, clinic data, and this data can be used as an early warning. If we see more sales of fever drugs, pyrexia might be a problem. So if you look at the school data, a lot of students are asked for sick leave. We have to look at why. In the past, we had to rely on reporting, but you have a very narrow coverage. So therefore, they want to use AI for prediction. So machine can help with the digitalization. So with this pandemic, the government is more tolerant to the online practice. This is my observations. Okay, thank you for the questions. Well, time permits, we don't have further time for questions. Jessica, would you wrap up? Well, I'd like to just thank you, those of you in presence or online who are sacrificing your valuable sleeping time. I just have 3 points to make. We spent quite a bit of time today, but we hope you're going to see the healthcare ecosystem has huge potential. And we do this. You see, we do this with passion. And we find this highly meaningful. It benefits the country, it benefits the nation, it benefits the people, and it benefits ourselves. If we do it well, just like the media's question, if we do it well, it solves many problems. It solves the problem for government, for healthcare providers, doctors, and even saving patients' lives. And for the ordinary citizen, 10% of disposable income is spent on healthcare. This is a huge number. And every year, the expenses continue to grow by 15% per annum. So how do we control the expenses while maintaining quality? This is difficult. It cannot be done easily. So first of all, this is a huge market and it's a meaningful cause. And it helps our core business. It's tremendously helpful of customer acquisition, improving stickiness and improving value and share of wallets. And secondly, to do this, it's not easy. Of course, we want to get the value, but value do not just come from the sky. We spent 20 years starting from insurance, medical services to the ecosystem. We took the trouble. I think we were the only company in China who took the trouble on doing a such large scale with 12 entities with so much investment, because we are convinced of the value, and the value has to come as certain efforts. We have to address the core and root issues. You have to approach the issue from the 5 aspects. But you can already sense great values. The value coming from contribution to our core business, and the value from the healthcare itself. Now, thirdly, whatever we say, this is probably the first sharing not just the good doctor, but also the ecosystem. But we only talk about 2 out of the 12 entities. There are still 10 entities who are not being fully represented today. But it's not just about empty talks. What we show you today should be enough to convince you that our robust competence in the healthcare, not just in revenue. You're going to see more revenue coming from Good Doctor, from other entities, but more importantly, it comes from the value extraction from the entire ecosystem. We're convinced that in the financial ecosystem and healthcare ecosystem, we are one of a kind. So thank you so much.